swelling, headache or a rash, asthma, colitis, fatigue, or gas. What will today's symptom be? My loopy life with lupus. Hey guys, so I am trying out a new camera today. I bought myself a Canon PowerShot camera. I was looking up some information on something to do with editing vlogs for YouTube. I hope I'm filming this correctly. I hope like you guys can see me and everything. So I'll see how long I can do this, but because my arm is really hurting today, I'm going to get to that in a second. But anyways, yeah, I was just doing some research on vlogging and like editing and crap like that. And I was like, I came across like this blog about like, you know, things that you could use like for vlogging or whatever. And they suggested this camera because it can shoot in HD. Sorry guys, I'm just trying to grip this comfortably. Anyways, yeah, so what I've been using to film in HD is my big Canon Rebel that Alex got me for my 30th birthday. And I mean, don't get me wrong, the video is great, the pictures are great, love that camera. But I thought, you know, when I'm on the go, it's not very practical because it's so big and bulky and it's really heavy, and I can't, you know, hold it in one hand like I am with this camera. And so I went out and found this actually on clearance at Walmart for like under $200, which was great. And I thought it would be great for when I go to the Down East Doll show this summer, because it's so thin and so light and so small. It's going to be so easy. I can just slip it in my purse and it'll be perfect. And I can film in HD and do all that stuff. So yeah. And so yes, with that said, yes, I am definitely going to the Down East Doll show. I have booked my flight. I have booked my hotel. And I am going because I got a raise at work, and I have, when this job ends at the end of June, I have a job secured for July and August. And that is going to be taking care of Ben again. I don't know if for those who are new, I'm thinking now it's probably been 2 years since I looked after Ben. He was another family that I worked for on the exact same street that I'm working on now, which is crazy. He's literally just down the street, a few houses down. And his mom contacted me asking if I'd like to watch him and her neighbor's daughter for the summer vacation. And it's just going to be from 9 until 12:30 every day. And the pay is like awesome because it's a nanny share. It's like so good. So I've got that secured for, so I'm good. So now I don't have to look for a job until September. And so because of all this being set in place, I could definitely afford to go to the show. Yay! Yeah, so that's that out of the way. Yeah, I'm in a lot of pain today, and this video is mainly going to be talking about managing the joint pain that comes with lupus, because I'm having a really difficult time with this. I actually, a few months ago, I purchased a WagJag deal for 2-hour-long in-home massages for $39, which I thought was great. I do love getting massages. I've had 3 done at the spa so far, and I think, what was it, one was just like a half-hour massage, so they only do like your shoulders, your neck, and your back. But then right before my wedding, my mother-in-law treated me to a full body massage, which was like an hour-long massage, and it was great. And then I had one done 2 days before the trip to the Downey Stall show last summer. And that was an hour-long full body massage. It was great. And I'm not sure. I hope my crazy old thumb is not blocking this. I'm really trying to hold this good, and I hope I'm not cutting off half of me. But yeah, so I thought this was going to be great. I remember reading when I bought it that it didn't include taxes, and I don't know if it was like tips or fees or whatever. Little did I know that the extra fee would be an extra $30 per visit. So that's an extra $60 on top of the $39, which is crazy. So never again will I be purchasing that kind of stuff through WagJag, because really I probably could have just gone to the spa for cheaper. But it's kind of nice that they come to the home. Anyways, I had my first one last night. I was super excited about it. And it was nice. However, I was not thinking about the fact that we live in a basement, and I'm always, in the wintertime anyways, I am like always freezing in this basement unless I'm under my big, thick, Tide fleece blanket with like all the rads cranked up. And so we had 2 heaters on, but, and I was nice and warm prior to her arriving because I was under my blanket. But wasn't thinking I probably should have had like every heater on in this place like hours before she came to get it warm in here, because you got to get naked for the massage, and all they provide you with is like a little sheet. And so I was fine until about halfway through, and then I started to freeze because the oil that she was using on me was, you could tell it was like a minty, like mentholated kind of oil. And of course that has a cooling effect on the body, right? So that mixed with the fact that it was cold in here, I was freezing, and that didn't help me relax because I was shivering. And I didn't say anything to her. Alex said I should have, but really, what could she have done? It's the temperature of the place. And even if we had to turn on a third heater, it would take probably till the, an hour after the massage is over before it warms up. And so I ended up having a major Raynaud's attack in my hands and my feet. So the last half of the massage was not so good. Like, it felt good, but I was freezing, so that wasn't good. And then today, I'm sore from the massage. She really was like putting a lot of pressure, which I don't ever remember having before. I know that like in a massage, like here and there, you'll hit some tender spots, which is the whole point, is to work those out and whatever. But my neck, like up at the back here, feels bruised. Like it's, yeah. That's the only part that's tender. But then on top of that, I did not sleep well last night at all. It was not a night for me to take a sleeping pill, and so I kept waking up. And of course, the joints in my hands are just driving me crazy. And anyways, today, every part of that massage was undone because I went to work, and I was with Jeremy, who's getting quite heavy now. He's 13 months old. He's a really heavy kid. I try not to pick him up too much, but I had to obviously pick him up today to put him in the stroller because we went to a community center class, and then I had to take him out of the stroller and put him back in after a class, and so on and so forth. And then pushing the stroller because some spots on the sidewalk still have snow and ice. It was hard pushing it through. And so my arms were hurting and my hands were hurting from gripping the stroller. And what else? And then like I didn't want to wake him up because like when we left, before we left the class, he was getting really fussy, which I knew he was like really so where did I leave off? My camera shut down. My battery's dying, so I gotta hurry this up. Anyways, so before we left the class, he was getting fussy. Like during circle time, he didn't want to sit. He was like getting upset if I was trying to get him to sit, and he just wanted to walk around. And then I put him in his stroller and got him ready. And then as I was getting my boots and my coat on, he had like a huge meltdown because the stroller wasn't moving and whatever. And anyways, we left and he fell asleep in the stroller, and so I didn't want to wake him up. So I decided to hop on the bus and go over to the mall just to walk around inside where it's warm, and did that for like an hour. But he ended up waking up like almost as soon as we got there, and we missed our bus to come back and had to wait like a half hour. So we had like a half hour to kill, and he started to get like bored in the stroller and fussy, and it was just like because I know he was probably still tired because he usually naps like an hour and a half in the morning, so a half hour was not enough. Anyway, so got back to his house, had to get straight to getting my lunch because I was hungry, and then I had to get his lunch. It was just like a busy day, and every time I had to lift him, it was so painful. And so, long story short, which really it isn't short, I ramble too much. Yeah, I'm just in excruciating pain everywhere. My knees, my feet, my arms, my elbows, my hands. It's just horrible. And so I don't know, because it's been a couple weeks now, I guess, since I was at the lupus clinic, and my rheumatologist said to up my ibuprofen to 3 a day, and obviously it's not cutting it. Sometimes, most of the time I'm okay during the day, but by the time I leave to come home, the pain's usually starting, and then it gets really bad on the bus ride home. And then by the time I get home, it's bad, and I'm out on the couch the rest of the night and can't do anything, and that's depressing. And so the only option that like, from what the rheumatologist told me, the next thing that they would consider to helping with my joint pain would be methotrexate. And methotrexate is a drug that's usually used in cancer patients to treat cancer. And I decided to read up on this medication, and it's freaking me out. Because if this is the only other option, I don't really like this. And so I'm going to quickly read to you what I found. Sorry, it's shaky. I'm going to try to do this quickly before the battery dies. Basically, methotrexate may cause very serious life-threatening side effects. You should only take methotrexate to treat cancer or certain other conditions that are very severe and that cannot be treated without other medication. Talk to your doctor about the risks of taking methotrexate for your condition. Tell your doctor if you have or have had excess fluid in your stomach area or in the space around your lungs, and if you have or have ever had kidney disease. Also tell your doctor if you're taking non-steroidal anti-inflammatory drugs such as aspirin, blah, 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 ibuprofen, naproxen, which I'm on ibuprofen. These conditions and medications may increase the risk that you will develop serious side effects of methotrexate. Your doctor will monitor you more carefully and may need to give you a lower dose of methotrexate or stop your treatment with methotrexate. Methotrexate may cause a decrease in the number of blood cells made by your bone marrow. Tell your doctor if you have or have ever had a low number of any type of blood cells or any other problem with your blood cells, call your doctor immediately if you experience any of the following symptoms: sore throat, chills, fever, or other signs of infection, unusual bruising or bleeding, excessive tiredness, pale skin, or shortness of breath. Methotrexate may cause liver damage, especially when it is taken for a long period of time. If you drink or, well, okay, I don't drink, so I can skip that part. Blah, blah, blah. It's just kind of like some of the stuff doesn't apply to me. Call your doctor immediately if you experience any of the following symptoms: nausea, extreme tiredness, lack of energy, loss of appetite, pain in the upper right part of your stomach, yellowing of the skin or eyes, or flu-like symptoms. Your doctor may order liver biopsies before and during your treatment with methotrexate. Methotrexate may cause lung damage. Tell your doctor if you have or have ever had lung disease. And call your doctor immediately if you experience dry cough, fever, or shortness of breath. It may also cause damage to the lining of your mouth, stomach, and intestines. Yeah. Can cause ulcers, blah, blah, blah. Call your doctor right away if you have mouth sores, diarrhea, black tarry, or bloody stools. Okay, so got cut off again. Hopefully you can see me. And I'm going to try to, I don't know exactly where it cut off, so I'll just go back a bit. Yeah, so it can cause damage to the lining of your mouth, stomach, or intestines. And if you experience any of the following symptoms, stop taking methotrexate and call your doctor right away: mouth sores, diarrhea, black tarry or bloody stools, or vomit that is bloody or looks like coffee grounds. Lovely. Taking methotrexate may increase the risk that you will develop lymphoma, cancer that begins in the cells of the immune system. If you develop lymphoma, it might go away without treatment when you stop taking methotrexate, or it might need to be treated with chemotherapy. If you are taking methotrexate to treat cancer, you may develop certain complications as methotrexate works to destroy the cancer cells. Your doctor will monitor you carefully and treat these complications if they occur. Methotrexate may cause serious or life-threatening skin reactions. If you experience any of the following symptoms, call your doctor immediately: fever, rash, blisters, or peeling skin. Methotrexate may decrease the activity of your immune system. Yay for that. And you may develop serious infections. Tell your doctor if you have any type of infection, and if you have or have ever had any condition that affects your immune system. Your doctor may tell you that you should not take methotrexate unless you have life-threatening cancer. If you experience signs of infection such as a sore throat, cough, fever, or chills, call your doctor immediately. If you take methotrexate while you're being treated with, okay, well that wouldn't apply to me because I wouldn't be having radiation. Keep all appointments with your doctor in the laboratory. Your doctor will order certain lab tests before, during, and after your treatment to check your body's response to methotrexate and to treat side effects before they become severe. Tell your doctor if you or your partner is pregnant or plan to become pregnant. If you are female, you will need to take a pregnancy test before you begin methotrexate. Use a reliable method of birth control so that you or your partner will not become pregnant during during or shortly after your treatment. If you are male, you and your female partner should continue to use birth control for 3 months after you stop taking methotrexate. If you're a female, you should continue to use birth control until you have had one menstrual period that began after you stop taking methotrexate. If you or your partner become pregnant, call your doctor immediately because methotrexate may cause harm or death to the fetus. Yeah, so that's basically the side effects of methotrexate. It basically says that they use it to treat either cancer or rheumatoid arthritis or severe psoriasis. And then, of course, it can also be used for lupus because it lowers your immune system, like suppresses your immune system so it doesn't attack you. So yeah, methotrexate. Yeah, I don't know what to do. I don't want steroids. I really want to avoid that at all costs, but my pain is increasing and not being managed with the ibuprofen. So I don't know. I guess I'm going to have to call my doctor and talk to her, but methotrexate is not something I want to do either. So this is the problem with lupus, is that pretty much all the medications used to treat it cause really bad side effects, or can cause really bad side effects. So yeah, that's where I'm at with that. If you are on methotrexate or have taken methotrexate, can you please leave something in the comment and tell me what your thoughts are and your experience with it, because I'm freaking out a little bit. And or just like tell me what else has helped you manage pain, because the worst is in my hands, and my hands and my arms, because obviously picking up Jeremy. And that is really bothering me because it's preventing me from doing a lot of stuff that I like to do, like scrapbooking, crafting, reboarding. I'd like to come home and be able to do some of that, but I'm in so much pain that I'm out on the couch all night. So I'm not having a good time. So anyways, guys, I'm going to stop rambling because this is probably like a long video. And yeah, I'm going to go, and I will talk to you guys in the next video. Toodles.